This is unfortunately what can happen to your brain if you sit on the toilet for too long and get up all of a sudden. This is a CAT scan of the brain right here, and when you see this white part is not normal, and that's actually a bleed, and what we call subdural hematoma. I once saw a 50-year-old man that fainted after sitting on the toilet for 30 minutes. He fell down, he hit his head, and when he was brought in by his wife, we found that he had head bleed. Well, why did he faint? Well, prolonged sitting allows gravity to pull the blood into your legs, and when you stand up suddenly, there is a redistribution of the blood throughout your entire body. And when there is not enough blood going into your brain, you can pass out from that. But how long is too long? Well, that depends on the person and how much water you had to drink, how good your autonomic system is, how conditioned you are, and other factors. And when you go to the bathroom, whether it's going number one or number two, that itself can trigger a reflex syncope, or what we call vasovagal syncope. And syncope is just a fancy word for passing out. But when you strain really hard when you poop, what we call the Valsalva maneuver, you can cause your blood vessels to expand and cause your heart rate to drop. And this would then lead to less blood going into your brain. On top of that, when you strain, a lot of pressure can build up in your chest, and less blood is then able to return to your heart, which then is another risk factor for decreased blood flow to your brain when you suddenly stand up. Unless you have a bowel issue that always keep you on the toilet for a long time, for the rest of us, when you do your business in the bathroom, you should try to make it quick. If you're having a hard time pooping, check the simple things like, are you drinking enough water or eating enough fiber? And consider putting your phone away and give your brain a mental break.